There's like no one on.
Lunchtime still.
I know. Good afternoon, Patty. Good afternoon, AM.
Alexa, play Santana Radio.
I was gonna say you're gonna get some gangster stuff now.
Yeah, no, it's just Panda song, man.
Good afternoon, everyone. We are live in San Antonio, Texas with Dr. Cornejo, also known as Dr. Latin Heat. Today we are doing some lipo. So she's doing lipo 360, which means lipo to the front, lipo to the back. She's also doing some chin lipo and some lipo to her arms. So she's doing, most people are, when they come in for lipo 360, they're getting their back, they're getting their tummy, they're getting their sides. She's also doing her arms and her chin. We all know we have that pesky double chin that's more common than not for us, so getting rid of that today. She's also doing a BBL, so taking all that fat we get from the lipo and putting it into her butt, give her that nice rounded shape. We're doing a removal and replacement of her current implants. Is she going bigger?
She's going bigger.
Okay, so she's going to go bigger. She's going to 450 cc's on both sides, and we're doing a lift, so it's called a mastopexy, a breast lift. So she's getting the work done. She's getting her body done for the summertime. She should be healing up close to time to go to the beach. It's a little warmer. Here in San Antonio it gets warmer faster, but yeah. Time for June, July. If you guys have any questions, feel free to drop them in here. We are showing this one on YouTube as well. She was kind enough to let us show this on YouTube so you guys can take a good look at the surgery. So if you want to hop over to YouTube, you can go to the link in our bio, or you can go to YouTube and search at Dr. Jeneby Plastic Surgery. Sometimes it's a little bit easier. And ask any questions. We're here to answer and provide some education for things you want to know. And also, our May specials just went up, so we have specials on almost everything she's getting. The BBL, lipo, or mommy makeover rather, she is a special. Then breast augmentation's on special. So make sure to check those out and book your consultation. We are getting busier since it's that time of the year for people to take time off and all that, so book it fast. Raquel, Jeanette, good afternoon. Happy Thursday. See, some of you jumped over to YouTube. Yeah, she's not too doesn't have a ton of fat, which is great because it'll give her that nice hourglass shape she's looking for.
But we'll see. We'll see if we can get maybe 1.5 liters.
There you go.
That's like a little too much, but we'll see.
It's $1,000 off. They want to know how much. Yeah, that one I make over. $1,000 off for the month of May.
It's called
Oh yeah, yeah, I've been there.
Yeah, it's right on the food. That place is.
I haven't been there in a while, though, but I went there a lot when they were
Trisha,
opening.
Love Jones, good morning, good afternoon,
It's
rather.
like,
They have like a fire roasted salmon that they make.
yeah, it's basically Mediterranean,
good.
no, or something.
Mediterranean.
Yeah. It's nice.
That other one's really good though. That French one, or you never been
Yeah,
there?
I've been there once. No, it's super nice, yeah. But it's been a year or more that no, actually, a couple years. I'll let you know if it's still good.
Hello, Dee.
want to do the left side first, and then we'll do the right side, so you'll be able to see the difference
There you go. Good.
in the light.
This one? Uh-huh.
Alexa, Alexa, play 80s disco from Pandora.
Good afternoon, Rosa, Patricia. Good afternoon. You guys for the ones that are just joining us. We are live in San Antonio, Texas
Alexa, volume 4.
with Dr. Cornejo, also known as Dr. Latin Heat, and we are doing a full body procedure today. We're doing BBL with lipo 360, so she's getting lipo on the front and the back. She's also doing lipo to her chin, doing lipo to her arms. Those are very common problem areas for women especially, but men and women alike. She's doing a removal and replacement of her current implants and getting some new ones, some bigger implants, 450 cc's on both sides, which is a nice, good large size. And then she's doing a breast lift. If you guys have questions, feel free to drop them in here. Be sure to check out our May specials going on as well. They just launched today. And I'm going to pin this to the screen if you're interested in booking a consultation or getting a quote. We have a bunch of financing options, third-party lenders, in-house financing. We have discounts for cash. Our cash people out there, I know it's tax refund time, so it's a good time to take advantage of those discounts that we offer for cash. And yeah, we're happy to help. And she's gonna look nice with that tiny waist with her size.
Mm-hmm. Yes, I'm trying to really get rid of all the fat here so that you can see her waist and her hips. That's it.
This is her first surgery?
No.
Well, besides the breast augmentation?
Previous lipo,
Oh, okay.
and a long time ago. And so, but thankfully her fat is not as scarred.
Okay.
Sometimes if I can be really scarred.
And hard to get through?
Yeah, you cannot get enough.
Is it just thicker tissue when it's scarring? Is that what it is?
Well, it's just some people, you know, it's like any liposuction leaves a scar on your, you know, in the subcutaneous tissue, and sometimes that fat can become really hard and fibrotic. And
Okay.
it's really hard to kind of like suck it.
Okay.
Like it doesn't come out, but it's just actually the fat looks actually really good.
Oh yeah? You guys see there, YouTube. We are in San Antonio, Texas, in the Stone Oak area. So this particular patient is not doing an add-on, but sometimes when we do the lipo, we'll do add-ons of Renuvion, which more common for our patients that have a lot more weight loss. But it's going to help tighten up that loose skin, that extra skin that happens when you have the fat taken away. They'll go through our skinny shot or go through some sort of a diet program, lose weight, then they'll get lipo, and then you have all that extra skin there from the fat being taken away. And so Renuvion is going to help tighten up that skin, make it look better, firmer, and yeah, we always have specials on our add-ons for that too. It's very, I would say, probably 7 out of 10 people at it. Wouldn't you say?
Yeah.
Maybe a little less.
Yeah. A little bit called Renuvion. That's one thing we can do sometimes.
And then with BBLs, we also do Morpheus, which is going to help reduce the appearance of the cellulite. I mean, on other things too, but BBLs are very common for that. We have videos of both of those on our social channels. Feel free to ask any questions, guys. Everyone's quiet today. We're happy to answer anything you want to know about getting ready for surgery, services we offer, how to book an appointment, what the post-op care is like, or what the recovery time is like. Feel free to ask away. We also have a med spa here across the street. We're having some good specials on that. We're having some Fiesta sales, Cinco de Mayo sales coming up, flash sales. Those are only going to be 24 hours. Mother's Day, and we're going to have a Mother's Day sale and a Cinco de Mayo sale for plastic surgery as well. So stay tuned to see what those are going to be, because they're only going to be good for 24 hours. Closer here. What are your favorite surgeries to do? Let me move out of your way.
I like to do more makeovers. I like to do noses. And I like to do facial rejuvenation.
There you go.
More makeovers, facial rejuvenation,
Rhinoplasties.
and rhinoplasty.
I like watching the rhinoplasties.
And, I like it.
Changes someone's whole face.
Yes. No pressure.
Yeah, right. Do you guys see here? We have our anesthesiologist here the whole time to monitor while our patients are under. From the second he or she goes down till after they wake up. With Fernanda? Yeah. I just posted the specials, so it's got to wait a little bit, but... You want me to text her?
I just heard it over talking. She said, no, it's not up yet, so I just wanted you to know that I heard.
Oh, thank you. Yeah, no, the specials just went up, so you have to space them a little bit, but it's a funny one. Thank you. post it for her now, so she's happy.
Table up, please. Made it, let me go.
It might be on the panel on the floor.
Oh, yeah. Thank you.
Chilling here. It's like one person, then 5 people, then one person, then 5 people. I can't tell if it's the same person on there either to know if I'm telling him the same thing over and over. So here he's getting the lipo on the arms. Get you guys a good look there for our YouTube viewers. Right, for anyone new joining us, we are live in San Antonio, Texas with Dr. Cornejo, also known as Dr. Latin Heat. And today we are doing a lipo 360, so she's doing lipo to her front, lipo to her back, so tummy, sides, back, all those areas. She's also doing additional lipo to her arms and her chin. Like I mentioned before, those areas are kind of pesky areas for us, so getting the back of the arms, getting that chin lipo, get that fat out, making her more toned and her face slimmer, well, looking slimmer. The fat we're taking from her lipo, we're going to be putting into her butt for a BBL. So she's looking for a bigger, rounder booty. And we're also working on her breasts today. We're doing what we call an R&R, which is removal and replacement. So she's doing a removal of her current implants and replacing them with new 450 cc's on both sides, and she's lifting them. So she's doing a mastopexy as well. You guys can see this live on YouTube. We are showing this on YouTube. And where you can watch the entire procedure happening. And we also are available for any comments, questions you guys have, and we're happy to help with anything, whether it's how do I book an appointment, or what kind of financing we offer, getting a consultation here and anything you want to know before surgery, services we offer, please feel free to ask. We are happy to help. And we are lucky to have this on YouTube because we're going to show the difference in the sides once he the lipo on each side.
Look, please.
Get a little bit closer here.
See a little bit. Let me show you something here. This is gonna be. So you can show something that is big. What's look.
She walked in.
Listen, if you come on to here, you can see. If you come on to there, you'll see.
You guys can see. On here, it's thinner.
We haven't done light on this side yet.
You can see there's more curve here. So right here, you can see the curves on this side. It's a little curved, but more straight for sure.
Okay, so you're gonna give him a break because we are going to get the cannula.
Okay.
Have a little bit of time. We'll
All right,
be back.
guys. I'm gonna be back.
Bible stuff, yeah.